started. Hi, everybody. My name is Brian Rosenberg, and I'm the founder of Gays with Kids. I want to thank you, each of you, for joining us tonight. To our presenters, and especially our dads, Jamie and Thomas, we appreciate your interest in sharing your expertise to help uncomplicate the surrogacy journey for the prospective dads who are joining us tonight. And to those of you who are here to learn about surrogacy and IVF, I want to let you know that the GWK team is really thrilled to support you along each step of your journey. In addition to our ongoing series of webinars like this one, we have lots and lots of great content on our website to educate and prepare you for your journey ahead. If you haven't already done so, excuse me, I encourage you to review our guide of 9 chapters that will take you through each of the key aspects of a typical surrogacy journey. And if you're overwhelmed trying to find the best family building partners to work with, we're happy to introduce you to some of the best of the best. I'll share the link to our pillar page and all things surrogacy and IVF in the chat section of this webinar, and again in our email follow-up that we'll send you all as well. All right, so tonight you're in for a special treat. We have a really great program for you. By the end of this webinar, you will have heard a firsthand account of a surrogacy journey from a couple who became first-time dads just last year. So everything's still fresh for them. And you'll understand the role of 2 of your most important family building partners, the IVF clinic and a surrogacy agency. All right. So my husband and I created our family through a combination of adoption and surrogacy. So I can tell you from firsthand experience that it doesn't matter what your path to parenthood is, the secret to a successful and enjoyable journey to fatherhood is rather simple in concept. You must find the best family building partners for you, for your situation, your personality, and your unique needs. Now, GWK has been around for 7 years, actually 7 years last week, and we've shared hundreds and hundreds and hundreds of stories of queer men creating families. So the running theme among those who talk most favorably about their family building partners is that they chose organizations run by teams with immense experience, both in the field at large and more specifically, working with the LGBT community. And just as important as their experience is they share a passion for helping gay, bi, and trans men become dads that honestly matches my own. So speaking of the best, tonight you're going to meet 2 of them. Vicki Ferrara of Worldwide Surrogacy and Dr. Mark Leondires, whom I'll refer to as Dr. L, of Reproductive Medicine Associates of Connecticut and Gay Parents to Be. I promise you this, you will not find more qualified experts than either of these folks, and their expertise is matched by their incredible passion for working with our community. But before we invite Vicki and Dr. L to talk, I'm especially excited to introduce you now to Jamie and Tom Boulding-Bridges, who, as I mentioned, became dads just last year through surrogacy. And actually they worked with Vicki and Worldwide and with Dr. L and our Macy T. They're going to share their story with you tonight. One housekeeping note, please feel free, again, as I mentioned earlier, to use the chat or Q&A functions for all your questions. You can certainly post them as soon as you have them. Keep in mind that we'll likely answer them in the last 20 minutes of this webinar as we've allocated that time for Q&A. All right. Without further ado, I'm excited now to introduce you to Jamie and Thomas, dads to daughter Echo, whom unfortunately this is just too late for her to be able to join us. I personally was looking forward to seeing her, so I guess I'll just have to take it another time. Jamie and Thomas, thanks so much for joining us. I know everyone's going to be anxious to hear your story, so please go ahead. To those listening in addition to talking about their surrogacy journey, we've asked these guys to share some of their backstory for context. So without further ado, thank you.
Hey, thank you.
Thanks so much.
So yeah, new dads, we are exhausted. It's nearly my bedtime. But so just a little bit about us. We met 8 years ago in London, where I was studying and Jamie was working. And I think we went on our first date, and a week later, I found your toothbrush in my dorm room.
Yeah,
And
he managed an apartment for school that was like right next to London Bridge with no rent. So I moved in like a week later.
yeah, yeah, and I've been trying to get rid of him since. But it became very clear early on that we both wanted kids. I came from a very large family. I'm the eldest of six, and you always wanted children of your own. And so we just knew that that was always going to be a goal for us, and knew that we always wanted to expand our family. Um, and yeah, it took years and years of planning and saving and getting help from family members. But
Yeah, so when we were in London, we were going to move my aunt, who's very close to me. If you had seen, they featured us a while ago on the site, and my aunt really helped us with this journey. We were going to actually move her to London. That was the original plan. And I think it was it was 2015. So I think it was just when like DOMA was struck down, we were finally able to get Tom a green card. So we decided we would move to the States, and we moved to Florida. And we found out none of Tom's qualifications transferred because he was an occupational therapist there. So we had to go through school all over again. I mean, he literally had to redo his bachelor's and everything. And while we were doing that, we thought, you know, he's close toward the end. We've set ourselves up. Let's start looking. Let's start looking at having kids. And we were super excited
and had no idea where to start or where to go or what to do. So we actually came across Gays with Kids and found some local guys in our area who had just had their kids through surrogacy. And they actually recommended Dr. L and Vicki up in Connecticut. And it just so happened that the stars kind of aligned that I ended up going to PA school in Connecticut. So we were local. And that's how we came across them, and their reputation just preceded them. And we know that they have shared similar journeys to us, and we really wanted to have people that were not only experts in their chosen fields, but had a lot of expertise working with LGBT people, and you know, could empathize with us and have that shared experience with us as well, which was incredibly important.
You know what, one thing I think is important to share, and I think we block it out because it was actually a little bit of a traumatic point in the journey for us, was when we first were going to do this, we didn't do that much research. We were just so excited. And we picked a clinic without doing that much research. We even got to picking an egg donor. And we'd seen a video of her, and you start imagining what your children will look like, and you get really invested. And we were going to drop off like a significant check for a deposit, and they closed their doors that morning. And that was really hard for us because I think, you know, you really invest in this vision you get, especially once you get, like you dads will realize, once you get to that point, you start, you know, really getting excited. What will they look like? What will they sound like? And that's when we went back to the drawing board and we really did some research on who had great reputations in this field. And that brought us to RMA. And that also took us to Vicki. And I think as soon as we sat down with them, we felt like we were in great hands. We felt like we were part of these small families, and that they were going to really help see us through. So from something that was kind of traumatic in the beginning, it really took us to a place where we felt like we were kind of cocooned by all these incredible professionals that also had a passion for family building. So it was a happy accident kind of, but it put us on a great trajectory to build our family. And then I would say we had kind of more of like, we had a pretty textbook surrogacy journey. You know, when we were first introduced to our surrogate, Catherine, who's amazing, they told us, you know, she likes to do nature hikes with her kids in the woods and look for fairies. And she makes handmade baby clothes that she sells at markets. And we were like, who is this person? Like, is she for real? But she was amazing. And, you know, it's a confusing process, and the lines can be kind of blurry sometimes. So you got to keep working on boundaries, and, you know, but we're still really good friends with her and her children and her husband. And she's part of Echo's life because that's what we chose. Everyone's different. But it was just a wonderful journey.
Mhm.
We were so thrilled with the choices we made. Yeah. So that's kind of our story.
In a nutshell,
Yeah.
condensed down.
Great. Well, I'm sure we'll have lots of questions for you. In the meantime, do you want to talk? One of the things that I really want everyone on the webinar to understand is just how important, again, the relationship is, working with your family building partners, how they work with each other and with you, et cetera. So I'd love to hear a little, you started to allude to that, I know, but if you could share a little bit more, that'd be awesome.
Yeah, so, it was, I'm trying to think, the first day when I went to speak to Vicki, I was impressed with was she made time to see me personally, which I was really surprised by. I thought I would be speaking to someone else. And she really made time to sit, she sat down with me and told me about her family and why this was important for her, and that meant a lot. And then Tom came in and met her after that. And something that she helped us with is she described everything to us in a way that we could really understand, because we understood what the desire was to have a child. And then we understood what it looked like when we saw the pictures on Instagram of people leaving the hospital with the little car seat filled with a cute little cherub baby. We didn't understand anything in the middle, and Vicki did a wonderful job at walking us through what this was going to look like. And it got us hooked up with Dr. L. And when we sat down with Dr. L, I'm sure he's probably heard stranger questions, but we were asking him all kinds of questions about just everything you can think of, to like facial features. And we thought that one of our facial features would look okay on girls.
Yeah.
So
crazy stuff that runs through your mind that you lose sleep over at night, obviously. But again, very similar to Vicki, Dr. L, he sat down and took that time with us to really explain the process in ways, I'm in the medical field and I don't understand a lot of reproductive medicine. It's, such a niche specialty. And he sat down and really broke it down for us in ways that we could understand the whole process. He went through all of the models in his office, and, we walked away feeling confident in, not only our understanding of the process, but on in his ability to be able to get us where we need to be. And again, the entire time he was just very empathetic, and he has his own story and journeys that he shared with us. And we really appreciated the time that he spent to really, really help us understand the process there. So, really important to me, at least.
Yeah. And I will share for the dads, I think it's important to know that no matter how much people break it down for you and explain the process, there's going to be some anxieties that come with it. There are some moments in the process that it doesn't matter how much you understand them. For instance, when you transfer an embryo or embryos, depending on what you choose, you have to wait about 10 to 12 days to find out if it worked. And I'm a psychotherapist, so I help people deal with their anxiety for a living. And during that time, I went out and panic bought another dog. And I was stuck with 3 dogs because I couldn't wait 10 days to find out if we were pregnant or not. So spoiler alert, obviously we were pregnant, and now we have a 2-month-old dog to add to our other 2. So let me tell you, it's definitely an intense process, but your relationship to these 2 people, they will be the point of, your point of reference for the whole journey. And they've always been open for us to ask them questions, to go back to them in times of uncertainty and in times of joy. I still remember Vicki giving us, that huge hug when we were in the courtroom doing the birth certificates, all of that stuff. And just remembering, it felt like family was there. And it was just, it's been a wonderful trip with both of these agencies. So I highly recommend them.
That's great. Thank you so much, guys. Appreciate that. So if you don't mind just sticking around, and I know we'll have some questions for you. All right. Next up, Vicki. Thank you once again for joining us. Could you please take a few moments to share your background and history with us, and then we get into the role of a surrogacy agency and everything that you guys are responsible for as part of the surrogacy journey.
Sure. Yeah. So, well, first of all, I have goosebumps from hearing the guys tell their story. And I do remember that moment in court when you became legal parents. And, you know, I mean, I always get reminded when I talk to intended parents and new parents about how much I love this work, but hearing you really made my heart open. And I'm so grateful that I have this opportunity to get to know guys like you and to participate in this like just amazing time in your life. And it's incredible. So I'm gay. I have a partner and we have 2 children. One I had by anonymous sperm donor and I gave birth to him, and the other we adopted. And those guys are 26 and 21 now. So we got through the teenage years, sort of. But that's really how I got into surrogacy, was by being an out lawyer for many years. And about 15 years ago, clients started to ask me if I could help them find a surrogate. And that's when I started to do matching. I was always a lawyer specializing in assisted reproduction law and LGBTQ law. And I got more into assisted reproduction law and surrogacy law when I started to do matching of surrogates with intended parents. And that's when I started the agency, and we've grown ever so nicely and slowly and steadily over the years. So now worldwide surrogacy has about 90 to 100 babies every year. And we have clients from all over the world. And we work often with Dr. Leondires in RMA, Connecticut. We happen to be in the same geographical location. So I've gotten to know Dr. L really well over the years, and we become friends. And it is like a family. Like you saw the picture of my team and me in the beginning slide, and we're like that. You know, we're a happy group. I have a good retention with my people who work with me. And so we know each other for a long time, and we like each other and we love each other. And we bring people into our nest like family. So you guys became like family to us, and our other parents become like family to us. Now that I have 2 adult sons, I'm like, all you guys are becoming like sons to me, which I really mean. Like, I absolutely love that feeling of being like kind of like your mom through the process. And so, yeah, I try to break it down. It is a complicated process going through surrogacy, and you guys explained that well. It's very daunting, and the worst thing about it is how expensive it is. Other than that, it's a very wonderful process in the United States. It's very safe legally, it's very advanced medically, and ethically. The framework here in the US is the best in the world. So we should go through the screen now? Is this?
Yes, please.
Yeah. Okay, so one of the 2 important things that that we do, that any good reputable agency will do, is provide good case support and management and rigorous screening of any surrogate that becomes a surrogate. So in our agency, the case management is the team approach. You would have a case manager. You would always have me as the legal advisor. I would be sometimes doing the legal work, and then I would often be monitoring and supervising the legal work if, for example, a surrogate lives in a state where I'm not licensed. So we would be organizing with that lawyer in that state and keeping in touch with him or her to make sure the work gets done. And then we have a couple of women on our team who were, and actually one is pregnant now as a surrogate, and they lead a team that supports the surrogates. So every surrogate, in terms of the case management, has a support person, which I insist that they keep in touch with her regularly and consistently. So at least once a week, but it's oftentimes more than that, like around the time of the embryo transfer and around the time of the matching. It's much more than once a week. So there's the 3-person approach to case management, and we are always Zooming with each other, sometimes meeting in the office to make sure that we all know what's happening with all the cases. And pandemic-wise, we've been fortunate. We have had no layoffs or furloughs as a result, so we're operating at full capacity. The other thing that's important, you can see it here in the slide, is matching with screened surrogates. So every surrogate has to have her own children. She has to live in a surrogacy favorable state. She has to be within a certain range of weight and age. She cannot be on welfare. That's for her sake and also for the stability of the process. And she can't be on any prescribed medication. If she meets these initial criteria, then she goes through a full psychological evaluation with a licensed clinical psychologist. In our agency, we have it done by an outside psychologist, so it's independent. There's no bias from anyone inside our firm that would pass someone. So the clinical psychologist does a very thorough job of making sure that anyone who passes is very stable, very sound, very dedicated, and knows what she's doing. And then if she's married, her husband will go through the psychological evaluation as well. Then she takes a personality test that's scored by this outside clinical psychologist. Then we do background investigations by a licensed private investigation firm. And we have a home check. We do the home check by way of the licensed private investigator. We like to do this because they do more than a social worker would do. They actually do like safety check for firearms, and all the other things that need to be checked for pets, cleanliness, and they check the neighborhood of where the person lives, and they check who lives in the household. So if there's any other adult, they would be screened as well. And then, of course, and most importantly, as importantly, we get all of her medical records and have them reviewed by Dr. L, who would then tell us whether she would be approved medically as a gestational surrogate. All that's done before you're matched with the surrogate. So once you like someone and she passes the screening, then you would be highly likely to go ahead with that surrogate. Things can happen, but it's very rare once we get to that stage. So during the matching period, your case manager will be showing you profiles. And if you don't like someone, that's fine. You decline and we move on to the next profile. The last thing I'll do is just describe the 3 stages of the process. So the first stage is this matching stage. And in our group, it's about 6 months. It's sometimes sooner, it's rarely longer. We really dedicate ourselves to matching in 6 months or less. And again, this is a very active period when you're in close contact with your case manager. You're going over profiles, we're getting to know you, we're getting to know what you want, we know what the surrogates want, and we eventually come to a good match that works for her and works for you. And then once you're matched, we go into the next stage, which is the legal and medical stage. It's approximately 3 months from match to embryo transfer. In the first part of this stage, we do a contract between you and your surrogate. Once that's done, the surrogate would go to the clinic, would meet with Dr. L, would be examined, and she would begin the medication protocol to prepare her body for the embryo transfer. Then she undergoes an embryo transfer, and hopefully, of course, we have a pregnancy. And there are what ifs. Whenever I have a consultation with intended parents, we do talk about the what ifs. What if she doesn't get pregnant? What if she doesn't pass the medical examination? What if she has a miscarriage? We talk about all that in close detail, so there aren't any surprises that we wouldn't have been able to at least discuss ahead of time. But the third phase is the wonderful phase of the pregnancy. So there, you'll have a good relationship with your surrogate. You'll keep in touch with her. She'll keep in touch with you. You'll go to appointments if you want, to special ultrasounds. And we are always there. Both Dr. Leondires would be there the first trimester of the pregnancy, and we would be there entire time supporting everyone. Usually people get into their pregnancy and don't need a lot of support as long as the pregnancy is going along well and healthy, and everyone is just going to appointments and getting excited about the birth. But one important thing during the pregnancy is the legal work to make sure that you as parents become the legal parents of your baby before the birth. And that's one of the special and really wonderful things about gestational surrogacy, the avoiding of the legal risk, so that at the time of the birth, you are the legal parents. You're at the hospital, you're recognized as a legal parent. When the baby's born, the baby's placed in your arms. Most likely there's enough space in the hospital to give you a private room to have special bonding time with your baby. And maybe you spend a little time with your surrogate, everybody's joyful and excited, and then you go home with your baby. And then you don't get any sleep like the guys described. But we're always there. I mean, we get a lot of, you guys, you ask some silly questions. There's no silly question in surrogacy. There's no, people ask, will a surrogate want to keep my baby? No, that's a very common question, and the answer is no. And we always go back to the screening. We always go back to the rigorous screening, psychological screening that we're doing to make sure we have a person who's completely understanding of what she's doing and very excited about building a family. And the other thing about that question is, if the surrogate wants to have a baby, she'll have her own baby. And as a matter of fact, she wants to make sure that you take your baby. She doesn't want the responsibility of another baby. So that's a question that we can answer, but it's certainly not a silly question. I mean, coming into surrogacy and not knowing who this woman will be who's going to carry your baby in utero and hand it over to you, it's certainly a really important question. And we're always happy to answer any questions. We did have one person ask us once who would be traveling home with him on the airplane to Belgium with his newborn baby. And we said, no, you're going to be a parent now. You're going to be taking care of your baby on the airplane. But so, and I don't even mean to make light of it. It's nerve-wracking. You're going to have a newborn baby and you're frightened. Like, what I felt frightened when I had a newborn baby. I remember thinking to myself, oh my God, he's here to stay, It's something that we actually do coach people, we actually do coach people about things that they need for the baby and what kind of support they might want to bring a parent or a friend along. So there's a lot to be discussed, and that's the role. And Brian mentioned it early on in one of the slides, the critical starting out place is to choose your professional team carefully and wisely, because you do want to have the support that you need to have and the people who care to answer your questions and be there to answer your questions as you go through the process.
Great. Thank you, Vicki.
You're welcome.
All right. Dr. L, thank you again for joining us as well. Could you please take a few moments to share your background and your family story? And then again, we get into the role of an IVF clinic and what you do during the surrogacy journey after that. Oh, you're on mute, actually, Dr. L.
Hello there, everybody. And, it's actually amazing. I don't know how many webinars I've done at this point in time, but I always get a little choked up because this is basically from our hearts. Everybody here on this webinar, this is kind of our passion and this is what we do. And I see this picture here, which is when we used to have, Pride. It's when I brought our kids to New York City Pride years and years ago now. We're much older now. And so, I'm a reproductive endocrinologist, which basically means I'm an uber science nerd. Everything from medical school to 4 years of OBGYN residency to 3 years of fellowship to, actually I was in the Army. I ran the IVF program in the Army, and then I came to Connecticut in 2002. And I didn't know that. About 2009, I've been helping people having babies since 1995. And I'm like, well, I really want to be a dad. It turns out I met this guy on the right, and within 3 months of meeting him, I said, listen, I'm going to be a dad. If you're not in, you're out. And he said he was in. And, it takes a while. And I think that's a hard thing to realize, because, here I know that I have the keys to the kingdom on the science side, but the surrogacy part, and the legal part, and who this woman who's going to carry the baby is a whole different side. So you really need this multidisciplinary team to get going. So, I'm really privileged and happy and honored that Vicki is literally down the street from my office. And we have been kind of working together for years upon years now. So we have the ability to pick up the phone or text if there's a problem with anything, and problems do come up. So in our own surrogacy journey, we had some problems. And when we've had our first child, I'm just like, this is too hard. So this is now 2011. And I was like, I need to try to help other families like ours make it easier. And that's when we started Gay Parents to Be. And it's just kind of rolled forward from there. And now I feel like, we've done over 700 transfers into surrogates. I'm so thrilled to hear family stories, get holiday cards every year. And, it literally brings tears to my eyes to hear some of the things that I just heard from you guys, and those special moments that you never expected, but to just keep popping up. And you guys have a lot more surprises to come. And, but it's just, if you want to be a parent, these hurdles are surmountable. We are willing to work to help you get over them. And it's, the job of your surrogacy agency and your IVF clinic to navigate these, left turns and things that come up. So I'm a pretty, process-oriented person. And in medical school, you're always checking your boxes. And I think in PA school, you have to show up in the morning and you have to check your boxes, right? So basically, if you're a two dad to be family, you have to decide if both of you want to be intended fathers, right? And then we have to decide if both of you have normal sperm counts, and if that's a good idea based on your family history. And then there's screening for genes that cause disease. We actually just increased the panel to 502 genes that cause disease from 283. So we're going to screen you and your partner, or you, if you're a single dad to be, for genes that cause disease. And then we're going to make sure that the next person that helps you, your egg donor, doesn't match a genetic profile that puts you at higher risk to have a child with a medical problem, right? So, on the IVF clinic side, we are responsible for the medical screening of the egg donor and the medical screening of the surrogate. And it's kind of brutal sometimes, but it is our job to say no, right? And it's a hard thing to sometimes advise someone that the egg donor you've chosen likely isn't going to produce enough eggs, or perhaps the surrogate that you've chosen, although everything she showed on paper looked great, when we looked at the inside of her uterus, there were some tumors there that are going to require surgery and might take her out of the mix for a while. So egg donor and surrogate medical screening, complying with FDA regulations, which are federal regulations, and following the guidelines of the American Society of Reproductive Medicine are the responsibility of the medical clinic. And, I'm one of 8 doctors, and I know exactly what happened to these guys when the clinic closed. Basically, we are a well-developed, mature practice and very secure in what we do. And that also means that sometimes, although the decisions are hard, we have the experience to basically say heartfeltly, if that's even a word, that this is not a good idea for you. Once we have your egg donor, and we do have an egg donor database, but I always like to say, the egg donor is one of the biggest decisions you'll ever make. So if you don't like an egg donor, or can't find an egg donor within our database, I have no preference of where your egg donor comes from. There's hundreds of agencies. We're going to screen them the same way. Your egg donor has to go through a process of stimulation. So normally women release 1 egg per month, but we're looking for 15 to 20 eggs to be retrieved, or sometimes even more. And then those eggs are retrieved. And if it's a known egg donor, usually if you're working with like Worldwide Surrogacy, Vicki would help us with a known egg donor agreement. And those eggs become your your eggs, right? This donor has willingly signed consent forms and completed legal paperwork, and then we're going to fertilize those eggs with your sperm. Oftentimes it's a split between one dad and another dad, or sometimes, actually sometimes there's a reason, even if you're a couple, to only use one sperm source. And then we watch embryos grow. And it's really a magical thing that happens in the laboratory when you go from one cell to an 150 cell embryo that has an inner cell mass that's going to become a baby, and an outer cell mass that's basically literally growing, expanding, and breaking out of a shell. And we can see these things in the laboratory. And that's a question that answers some of the questions about how successful you're going to be. Once we have these blastocysts, and actually only about 50% of fertilized eggs make blastocysts, we have the ability to test these embryos now. And we can take a sample off the cells that become the placenta, and with really high predictive value, basically tell you whether this embryo has the potential to make a healthy child, or perhaps it has an extra chromosome or is missing a chromosome, is more likely to have end up in a miscarriage or a pregnancy that doesn't go on to term. These, after the biopsy of the embryos, if you choose to do that, it's not required, it's not even recommended, but most people doing surrogacy, because the time and effort involved, want to make sure they're putting a normal embryo in. The embryos are cryopreserved. And then the process, your surrogate will come to our office. We will review the medical records before screening, and we'll medically screen her. And then there's a follow-up that usually actually happens by my nursing staff with the dads-to-be. And I'm sure Jamie and Tom have a lot of memories about talking to our nurses more than talking to me, right? And they actually really, hold your hand through the process. And your surrogate completes your screening. Your match is ongoing. Vicki has completed legal paperwork. And then we have a special conversation about which embryo do you want to transfer. And it's really kind of this moment in time that you finally got to this next goal line. And there's a lot of goal lines, right? But this is a big goal line. And your surrogate starts the endometrial lining development process. We thaw the selected embryo, and rarely we do double embryo transfer, so maybe embryos. And then there's that moment in time that we place this 150 cell embryo, which I'm sure these guys remember, into the uterus of this woman who usually is kind of a unicorn. You guys describe your unicorn, right? These are women who are already taking care of usually a lot of other people, and they're just happy to take care of you and take care of your baby for 9 months. That embryo transfer, it's a long 10-day wait. I remember our waiting period as well. You wait for that pregnancy test. Now here we have gay men waiting for a positive pregnancy test. I mean, that's just craziness, right? But this is the 21st century, right? So we wait for that positive pregnancy test. 2 days later, we look for it to go up nicely. And then from there's that first ultrasound. We look for a sac in the uterus. And then we're looking for a heartbeat, about 20 days of embryonic development. And then right around 45 to 50 days of embryonic development, or 10 weeks of pregnancy, we are basically releasing you and your surrogate to her OBGYN. And that's a little bit of a handoff where the surrogacy agency who brought the surrogate to the office kind of backed off a little bit while we did our medical stuff. They actually then take the football literally and get you all the things that need to be done so you can become dads. And it's a really special time. I mean, I love making my phone calls that you've graduated, that we are so happy for you, and give us a ring in 7 months and send us your pictures, right? And that's really the engine that helps my office run on a regular basis. Now, it's not all but puppy dogs and butterflies, and it is our responsibility to help you navigate the things that come up and help you make decisions. And that's where experience matters. I've been doing embryo transfers and helping people have families for 25 years at this point in time. So these are the 5 major phases of your surrogacy journey. If you want to kind of think about it as boxes to check, we need to get the dads to get cleared. So that's a semen analysis and your recessive carrier screening. Then you need to select your egg donor, and that's typically 2 to 3 months. And then our job as the IVF clinic is to create embryos. So your egg donor is selected and matched. Then it usually takes us another month or 2 to create embryos and cryopreserve embryos. At that point in time, you're either waiting for a surrogate or a surrogate's already been presented to you, and we start screening your surrogate. And then we prepare her uterus for embryo transfer. And then we complete that embryo transfer. And then we all have to sit and wait for the magic of biology, God, Mother Nature, whoever you believe in, to bring this little ball of cells really to life with a heartbeat, really at a 1.5 centimeters is when it about starts. So it's really kind of a magical moment. I mean, I have to say it's an honor and a privilege to do what I do on a daily basis and to help people have families, especially the LGBT community, which, we're like, we're about 15% of our practice is LGBT community. And these are people who couldn't have children without help. And we're able to help our community have families and build families. And it's just a wonderful, wonderful thing. So thank you for your time and attention. I look forward to questions. And I want to say, as far as working with Worldwide, Vicki and I have worked together for years. And one of the things that we definitely do together is take care of you and take care of anything that comes up together. And I want to say that, one of the things I've always been impressed with Vicki's agency is that she is a problem solver, and she will work to fix things for you. And we're both passionate about getting you to the point where you're holding your baby.
That's great. Thank you so much, Dr. L. That was awesome. All right, so we've already got a bunch of questions here. First off, guys, I presume your friend Alex Salinas wants to know when you're moving back to Florida. So please let him or her know. Vicki, the first one was for you. What criteria is used for the initial matching stage?
Okay. So basically, the surrogates who are applying fill out a long questionnaire profile, and so do the parents. The parents fill in a lengthy profile, and we get to know everyone. Your case manager and I will be getting to know you and what you hope for in a surrogate and what's on your wish list. And we're also getting to know the surrogates and what they're hoping for in their surrogacy journey. So the match is really carefully tailored to each of the people involved. And sometimes people want to know if the surrogate has insurance. Sometimes they want to know where she lives. Of course, the big things like if there's a birth defect, will the surrogate be willing to terminate the pregnancy, assuming the parents want to? So that's a very big issue that needs to be covered by the psychologist, needs to be covered by us, and needs to be covered by the medical team. So a lot goes into the criteria for matching, but it's all discussed really clearly and openly in the beginning stages when you sign on with the agency.
Okay, great. Thank you. The next question really, it's for both Vicki and Dr. L. Someone's asking about egg donor databases, and I think the rather question is, who do you work with to get your egg donors? Do you want to, either of you want to take that?
I'm going to jump in and then I'll turn it over to Mark. I'll just say quickly that Worldwide specializes in recruiting and screening gestational surrogates, and we do not have an egg donor database. We always recommend that the parents turn to the clinic and start there to look for their egg donor.
Yes. So egg donors are typically young women between the ages of 21 and 31. And, at any one time, we have about 40 to 60 egg donors in our database, which is a relatively small number, I will tell you. And it's a constantly rotating pool. And these are all gals that usually live within 100 to 150 miles of our office. And there's a lot of opportunities to work with a clinic-based donor that is fully medically screened, psychologically screened, and available. But it has to be a good donor for you. when I meet with you individually, I will send you a list of actually, 10 other egg donor agencies that we regularly work with, because your egg donor is, donating half of her genetics to your future family, right? So it's an important decision. So most people take about, 1 to 3 months to choose an egg donor, and it takes time. The advantages of working with a clinic egg donor is it usually saves you some money on travel. They're fully screened, so they're ready to move forward, and we know them. So and we have a track record with them oftentimes. One of the things I would like Jamie and Tom to talk about is what was it like for them to choose an egg donor? Now, I remember, 10 years ago when we were looking at an egg donor, Greg thought this was important and I thought that was important, and there was compromise at play. But it is a hard thing to do, and I encourage you to take your time with it. Guys, do you have any comments on choosing an egg donor, and where did you find your egg donor?
So we actually found our donor with your pool. And for us, I think the most important thing was how are we going to have a healthy baby? And it was always health first. And we found that with your pool and our confidence in your screening, we knew that that would be a priority. And also how the profiles were laid out were very easy to digest. You had family trees. There was a profile with each egg donor with their history, their
some social stuff
about them. And so that really helped us kind of, it's a process, and you kind of have to just sit down together and say, reflect and say, what is important to us? Why are we doing this? And really just go through each profile one by one. And I think, like you said, it can take time. This can take, a month or two at least.
And I also want to just normalize something for anyone struggling with it. Like, we sound pretty zen about it now, but I remember looking at profiles and being like, her favorite movie is Secret Life of Pets. It's a no.
Absolutely not.
Things like she doesn't like to read.
Yeah.
Like that, you know what I mean? And then all of a sudden we were like, you know what? This is someone who is generous and doing something amazing for us, and let's focus on what matters. And that was health. It was health. And we also wanted someone who generally looked like they resembled our background. I was born in Malta, so I'm Mediterranean and English, and Tom's English. So up in the Northeast, that wasn't too much of a challenge for us. So that's kind of how we went about it.
One of the things I saw a question came in about timeline. Timeline is something that everybody always asks, but I usually say that it's 15 to 24 months. And 15 months would be that you chose your egg donor, got your surrogate, we completed your IVF cycle, and you got pregnant the first time, right? Because it takes 9 months to have a baby, and that means you do all that in 6 months. So most people, I would say it's more like 18 months to 2 years from the time you decide you're going to do this and the time you have your baby. So it is a process, and it is a process of allocating funds to go through, right? You guys, I think you guys also had some experience in struggling to make that happen. Timeline wise, was that about it for you? 18 to 24 months, or?
It was, but remember, it was a little crazy because we found our surrogate very quickly. She skipped a few profiles and kind of chose us, and we didn't even have embryos yet.
Okay.
So we had the surrogate, but nothing to put in her. So that was wonderful too, because we became great friends with her over the few months we were waiting. Yeah. But I'd say it was like 18 months yes. Almost to the, yeah.
Great. So we have two other questions I want to make sure we get to. One is for all three of you, and that's just to talk about how the COVID has impacted a surrogacy journey. So Dr. Al and Vicki, I'd love for you to talk about it. And guys, we haven't shared yet that you're on, your first journey took place before the pandemic struck, and you just started a second journey recently, and that's right in the heart of things. So would love to hear from you as well. But do you want to start, Dr. Al?
Sure. COVID absolutely positively affected our practice, right? No question about it. We were completely closed to patients for 3 weeks. We were required by the state of Connecticut not to have our full staff in. It slowed the process down. But at this point in time, though, we very quickly, certainly by July, had our COVID legs about us, and we were very busy and navigating this Zoom environment and so on. So COVID has changed some things. One of the things I used to pride myself on is I would personally see every single surrogate for every single parent to be in person, check their uterus, meet them, do their physical exam. And now that's all done remotely. And I personally do a Zoom, right? All donors used to come for screening, because we can all dress ourselves up for a Zoom, but for somebody to get off the plane and show up and do everything. So I think there's a little bit of loss of that personal component. The process, though, still works, and we've navigated COVID actually very well. And for the practice as a whole, at this point in time, we are really kind of just working our little butts off to help people have babies. We're busy, and we're working through COVID. And there's a little bit of there's still some vaccine hesitancy and so on, but more and more people are vaccinated. And I do think there's some optimism on the front for us to be on the other side of this. Vicki can comment on this as well, but one of the biggest conversations I have right now is the surrogates getting their COVID vaccine. I had 2 of those conversations today, right? Should I not, how safe is it, and so on. So I think, Brian, that's where we are right now, is like, where do we go with the vaccine? But as far as proceeding on as a clinic, it's not affecting us really anymore.
Okay, great. Vicki?
Yeah, we were impacted too. Fortunately, we were busy too, and we are very busy now, because parents who didn't sign up in the past year are all signing up now, which is great, because people are not putting off any longer their desires to have their children and get on with the process. But I think in the beginning of the pandemic and through the summer, we were navigating some novel issues like travel, like international parents getting here, parents getting into the hospitals for the births of their babies. And we did handle those issues, I think, successfully for the most part, but it was always a little bit stressful. Like, could they get in? Could they not get in at the last minute? Some kind person at the hospital would get them in. So we were always on top of those issues and helping people, but it's much better now. The surrogates are traveling, and the parents are traveling, and the hospitals are still being very, very careful, but we are successfully navigating those problems.
Great, thank you. Dads, like I said, your first journey was pre-pandemic, and your second journey is in sort of not, you started several months ago, I presume. So do you want to talk to us about what it's been like? Is it different?
So Echo came in just as the pandemic started, and it was actually friends of ours gave birth just 4 weeks later, and they, the partner wasn't allowed to be present for the birth whilst we were just a month before. But something we have noticed just with us and with friends as well, some clinics right now, they may not want the fathers to be present during the ultrasounds. So before the pandemic, you could, go to ultrasound visits and be there, but some clinics may have rules, and this isn't just for gay parents, it's for, all their parents, that only the mother is allowed in the room, or the surrogate is allowed in the room for the ultrasounds, just to limit exposure for people. And we found as well that during the implantation process, so she could be tested before she went into the clinic. Connection's unstable.
Okay.
Yeah, that was definitely a big difference. And I will share that we decided, that was something we went through recently with the vaccine, and our surrogate got the vaccine. So we decided she was going to get it. So yeah, so now we're well on our way to having another child no one's going to get to meet. So we're excited about it.
You are definitely not going to get any sleep anytime soon. Several questions came up, Dr. L and Vicki, about twins and what that process is like and how does that work, et cetera. And since you both would be involved in that, do you want to share about that as well?
I think Dr. L should take that one.
Okay.
Yeah, I know Vicki has surrogates right now who openly say they only want to receive a single embryo. And I think those women are aware of the increased risk of pregnancy to them and even the increased risk of pregnancy to the unborn child. On our side, we allow double embryo transfers, but I don't recommend double embryo transfers for basically, several reasons, but there's a 15% increased risk of complications in a twin pregnancy. Everything from just being born too early and, to major birth defects, to developmental delay and autism. And I think the one thing that we want the most for our children to be is we want them to be healthy. So to take a 1 out of a 15% risk with the health and well-being of your child is a tough thing to do. Some dads to be are in a situation that they can never afford to do 2 surrogacy journeys. And that is the reason why they take that risk. Some people are just, we're going to love any children we're going to have. And they really want to have twins, and I will counsel them. The American Society for Reproductive Medicine and the Society for Assisted Reproductive Technologies kind of require us to do a pretty firm counseling session against double embryo transfers. And the good news and the change is that I used to transfer 5, 6, 7 embryos, then it was 3 and 4 embryos, and then it was, 2, and now, about 90% of transfers are single embryo transfers because the sustained implantation rate, especially with thawed embryos from an egg donor, is 70 to 80%. So you do not need to transfer 2 embryos to have a baby anymore. And when you think about the risks of twins, it might be not a good idea for your child to be. So we talk about it, we discuss it. It is harder to find a surrogate who's willing to take 2. And then you have to understand when you are pregnant with twins, there's more risk for miscarriage, complications, up until, you get those babies in your arms. Anybody who we transfer to, we're always rooting for them to be okay. And we cross our fingers, toes, and so on for that.
But Dr. I know we have a lot of guys want to go through the surrogacy process once, and each dad wants to have a biological connection. We've certainly shared lots of stories about dads who've done that. What do you say to those dads then?
Well, if they want to transfer one from one guy first and one from the next guy for the next journey, or they're going to do a double embryo transfer of one from each, right?
Yeah.
But remember, it's our most recent stats is 70% of double embryo transfers, just goes along what we just said for implantation rates, resulted in twin pregnancies. But just because you transfer 2 doesn't mean you're going to get 2 either. So you have to keep that in perspective as well. But if I would say about 80% of male couples do go ahead with a dual sperm source journey where they're both making embryos, and we freeze embryos for both. And then we decide whose embryo we're going to transfer for number 1. And then we transfer the opposite dad's embryos for number 2.
Gotcha. Okay, great. Someone's asking a question about mixing up. So along those lines, mix up the sperm from 2 dads. Is there a rationale, whether it's legal or medical, for making sure you understand who the genetic parent is for each child?
Well, number 1, we don't do swirlies. We've never done swirlies, and the FDA wouldn't approve us to do swirlies. And you need to know whose embryos belong to whom. But it is perfectly okay to tell us you don't want to know. And we can blind you and just transfer the best embryo from either dad for baby number 1. And the struggle comes down to, for when that baby's born, and Vicki can speak to this, some states require some degree of paternity testing. And then for me to transfer embryo number 2, well, I have to prove to you it's the other dad. So usually we have to kind of unlock that chest at that point in time. But by that point in time, your dad's already, you're trying to have baby number 2. Most dads to be are pretty comfortable knowing. That doesn't mean you have to share it with everybody. And to this day, my mother thinks the baby that is genetically related to me is actually genetically related to my husband, and vice versa. So she just sees what she wants to see.
And legally, you're right. I mean, for the most part, we need to know in almost all states, and we have to get an affidavit from you, Dr. L, saying which embryo you transferred and how it was made. So it's an interesting idea, but it's really not practical.
Okay, great. So we are out of time. Fabian, I promise you, we will respond to your last question via email. In the meantime, before we leave, Vicki and Dr. L, do you have any concluding remarks that you'd like to leave people with?
Congratulations on this big step, and I wish you the best of luck. And it's amazing to be a parent. So if something you want to do, let us help get you there.
Yeah, thank you for attending. We're really happy that you decided to join us, and we're here for you to have consultations with privately to answer more questions. And you're doing the right thing by joining a webinar like this to get information, and just keep getting your information and everything will fall into place.
Great, thanks. Dads, anything you want to say as parting words?
Well, one, I just want to thank everyone who showed up to listen to our story and wish you all the best of luck, whatever route you take. It's an incredible journey. And I just want to say a really heartfelt thank you to Dr. L and Vicki, because you really did make our dreams come true. And we see it every single day. She's amazing. And yeah, our hearts are full. So thank you.
We agree. And in fact, to that end, everyone, you will get an email following the webinar, and we'll give you access to more information about Dr. L and his clinic, and more information about Vicki and her agency with links on that email. So be on the lookout for that. All right. Thank you all so much. We appreciate, we know that you could get your information from a bunch of different sources. We appreciate you coming to Gays with Kids. I can tell you, again, we would love to be here to help you along every step of your journey. So please come back for future webinars and go check out our website. I left the link for the homepage of everything related to surrogacy and IVF. And we look forward to seeing you in another webinar.